Infertility or miscarriage is not the end of the world. It has treatment.
There is a risk of infertility or whether there is a risk of having pregnancy complications. So, what are the early steps or stages that you feel before trying to have a baby?
Meet a physician, get themselves checked for important conditions.
Doctor, do you recommend preconception screening? Anything specific?
Certain tests will be required, but not all tests can be done as a preventive thing.
Unexplained infertility means you will never know the cause. Doctor, specifically for women, if we've seen repeated miscarriages or IVF is not working, what preventive red flag should they not ignore at all?
So unfortunately, actually, there are no specific things which will tell, okay, this person or a person is going to have miscarriage or infertility.
What's fact, what's fiction, and what's the science we should actually trust? Hello and welcome back to What the Health, the podcast where we actually identify things which is difficult for people to understand, healthcare, making it very simple, challenge the myths, and bring out real solutions with the experts from the medical fraternity. Today we'll be talking about something which is a trouble for everybody. Infertility. The word itself says it is so heavy. For some couple, it is not only a medical journey, but it is an emotional turmoil as well. So, and we've seen that in many cases, people opt for IVF treatments, advanced treatments, but it doesn't work. So, what is it exactly which is going wrong? Why is it not working? What to do? Should we lose hope? There are so many questions. So, today we have Dr. Mohan Raut, gynecologist, a pioneer in the field of reproductive immunology, a researcher and a co-founder of Dr. Raut's Clinic of Reproductive Immunology. Welcome, Dr. Raut. I'm so happy to have you here today.
Thank you, Dr. Apurva. It's my pleasure to be here on this excellent podcast, and thanks for having me here.
So, doctor, let's begin with where every health journey begins, that is prevention. So, what are the early steps or stages that you feel before trying to have a baby? We should, understand whether there is a risk of infertility or whether there is a risk of having pregnancy complications.
See, doctor, at the beginning, I would like to say pregnancy is a very important aspect of any woman's, or for that matter, for any family's life. Okay, and it is an integral part of woman's dream, you can say. So therefore, pregnancy forms an important part. Now, whether it should be planned or whether it should just happen like that is you can say a query. Many a times ऐसे होता है कि पेशेंट्स हमारे पास आते हैं, कहते हैं डॉक्टर आई हैव मिस माय पीरियड, आई थिंक आई एम प्रेग्नेंट, बट आई हैव दिस प्रॉब्लम, आई हैव दैट प्रॉब्लम, नाउ विल दिस प्रेगनेंसी बी फाइन? So this happens many times. So therefore, pregnancy is something which is not to be taken casually. So what I would like to say is, if you want to have a baby, the best way is to plan it. Now, what I mean by planning also I will explain. There are 2 or 3 things I would say that before planning pregnancy we should consider, so that the pregnancy happens the right way, baby is healthy, and there are no chances that can cause problems in conception which can lead to, as you asked, about infertility or problems related to that. Because the first thing, most important thing is you should know you should know that you are healthy. So if there are any known factors or known diseases which you are suffering from, you must be aware about it. If you have those, say you have thyroid problem, you have diabetes, then those things have to be checked properly, put under control, and only then plan pregnancy. Suppose you are apparently healthy, everything is normal, मुझे तो कोई problem नहीं है. In that case also, it is the second part comes into action or play, that we must, the couple must know whether all these things are normal. So therefore, in the second part, they must meet a physician even before conceiving. Meet a physician, get themselves checked for important conditions, like say the blood count, the sugar, thyroid. So all these investigations should be done beforehand. So a consultation and followed by investigations, and only then they should plan pregnancy, which will have the pregnancy will become easy and will prevent complication. And third part, if you are doing something which is not going to be good for pregnancy, suppose someone is smoking or they have a habit of drinking or other habits which can affect pregnancy, they have to be or they have to stop them, give some time for body to recover, and only then plan. So these three things if they follow, then definitely the pregnancy will be healthy and they can prevent complications. Yes, in spite of that there might be problems, but if they follow this, I think that's the right way.
डॉक्टर आई टोटली अग्री बट मेनी पीपल फील कि मुझे कुछ फिजिकली नहीं हो रहा है मतलब आई एम हेल्दी सो दैट मिथ ऑल्सो वी नीड टू बर्स्ट कि when you see the signs you already have something, so even if you don't have anything, prevent, as we our podcast also says that prevention is the key. So I don't you feel that by default we should be doing some regular testing, whether pregnancy or not pregnancy, but कुछ नहीं दिख रहा मतलब मैं नॉर्मल हूँ, ये कंसेप्ट is wrong, I guess. What do you have to say about it?
Absolutely, very important point I think you have put forward, because otherwise also whether you are planning pregnancy or not, you have to be healthy. Okay, and it's not just that I am feeling healthy so I am healthy, right? So there are certain things which the person may not feel, but he has that problem. One important example I can say is diabetes. Patient has no symptoms, sugars are high for 10 years maybe, and patient may not have any symptoms. मुझे तो कुछ नहीं लग रहा है. When they check accidentally, they find out, oh, I have diabetes, and already certain complications have set in. So therefore, we can't take it lightly. आपने जो कहा absolutely सही है कि even if we feel we are healthy, we must get ourselves checked, investigated. Otherwise also routine certain checkups are important. And when you are planning pregnancy, so all the more.
Utmost important.
And it's not only wife. It also applies to husband also, because both are contributing to pregnancy. Right? So investigations of both of them are important so that we have a healthy pregnancy and we prevent complications during pregnancy.
Absolutely true, doctor. Doctor, do you recommend preconception screening or lifestyle changes or some immune health checks which apparently are important before planning? Anything specific?
Right. Now, when a couple is planning pregnancy, certain things have to be in place. Right, apart from the regular health which we just discussed, the sugar or thyroid and all, other parameters also should be normal so that they will have a healthy pregnancy or they won't have any problems. But here one important thing we should remember, that difficulties in conceiving or leading to infertility, there are certain known factors, and it is not practical to check everything before the couple plans pregnancy. I remember one couple who had come to me, maybe I thought they were couple. So they said, doctor, we are not conceiving for 2 years. What is the problem? We don't know. So I said, okay, you are trying for 2 years or you are married for 2 years? They said, we are not married, but we are just checking whether we will get a baby and only then we will get husband. That boy said, because I am the only son. So if she doesn't become pregnant, then what? There will be no one in my family later on. So we are checking whether she will conceive, and then we'll get married. So that is something extreme, but we don't require that type of experiment. But to do basic investigations to know whether the couple is healthy is important. And of course, there are certain tests like the infection test, like the HIV, and also those are usually should be done by couples before. We even advocate even before getting married now, rather than checking the other things, the jyotish and other things. It is better to check the blood groups or the infections, which are important part. So all those things are important. You mentioned about immunological things. So immunology is little a very specialized thing, you can say. So there are certain diseases which are immunological diseases, like say autoimmune diseases. that can affect pregnancy. But that's a different part. Most of the times that woman must be aware about that disease. But otherwise, it's not practical to check everything related to immunity problems, or for that matter, related to all problems of infertility. So many a times there is one controversial thing whether a semen analysis should be done before the couple gets married or before. So that's something which is a little controversial. But if you're planning pregnancy, and then your doctor will advise that, or if you're trying and you are not being successful, certain tests will be required. But not all tests can be done as a preventive thing, and certain things
Absolutely.
will come as the couple tries for the baby.
And any specific lifestyle changes that you would recommend?
Very important. I think I just mentioned briefly because there are certain lifestyle things which can affect pregnancy. Simple things like the weight. If the mother is overweight, then it has impact on ovulation. Can have difficulty in ovulation. If that is associated with a condition called polycystic ovarian disease (PCOD), then even weight loss becomes difficult. So certain lifestyle changes related to food are very important. Eating healthy food, bringing weight down as much as possible, that is very important. And harmful habits like smoking or drinking, they definitely adversely affect pregnancy. There are known effects of alcohol and tobacco on baby. Mothers who drink alcohol during pregnancy can cause a condition called as fetal alcohol syndrome, or baby has certain disorders. So with tobacco, there are possibilities of miscarriages or inability to conceive. Especially if the husband is smoking, there is effect on sperms. So these type of habits, means these lifestyle changes, are a must before planning pregnancy. Otherwise, there will be problems. There will be a few lucky who will escape. I'm not saying 100% everyone will have, but if you want a healthy child in time, then it is better to take care of these lifestyle problems. And I think it is not difficult because the couple is so motivated for the child. Most of them easily do that, and therefore pregnancy has to be planned. If you are not aware, and if you are with lifestyle changes are not there, then there can be complications.
Doctor, in fact, I feel that these lifestyle changes should be a part of everybody's life because आज नहीं तो कल ये affect करने ही वाला है. I mean, obviously, the couples planning pregnancy, definitely it might affect and it might have a larger impact. But in general, also we've seen nowadays that the disease trend, at an early age, we suffer from so many lifestyle diseases. So I think you rightly mentioned that these things definitely before planning is important. But in general, I think we should adopt those so that we lead a healthy life.
Absolutely. I think I must tell everyone these lifestyle problems will affect your health throughout your life. Whether if you are a child, you are in the childbearing age group, or you are an elderly person, these lifestyle related things have to be under control. They have to be checked, and then you can avoid problems. If you are in the childbearing age group, pregnancy related problems will be avoided. In later part, problems related to diabetes or other overweight related conditions. There are certain cancers which are more commonly seen in women or persons who are overweight. So all these things can be prevented or avoided by keeping these things in check, and therefore regular checkup and taking care of these lifestyle related conditions is very important.
Rightly said, doctor. Doctor, specifically for women, if we've seen repeated miscarriages or IVF is not working, what preventive red flag should they not ignore at all?
So I think this question is important because many times we see patients who have multiple miscarriages. Yesterday only there was one patient who had 5 miscarriages. So she said, "Doctor, was there any way where I could have guessed, or I would have known that I am not going to carry pregnancy beyond a particular date? Is there anything which I could have done beforehand?" So unfortunately, actually, there are no specific things which will tell, okay, this person or a person is going to have miscarriage or infertility. But again, coming back to those conditions that will predispose, that will lead to pregnancy related problems, जैसे कि weight ज़्यादा है, so they have keep in mind. Problem जैसे blood pressure ज़्यादा है, blood pressure का problem है, that can affect pregnancy. Then related to smoking है, husband अगर smoke कर रहा है तो that can have likely to have sperm count which is low. So all these certain things should you can say, as you said, red flags which can indicate yes there will be problems, or those might be leading to fertility related problems. But most of the times little more specific investigations will help us to pinpoint the factors.
Actually, the reason I ask this question is by the time the lady suffers through so many things, I mean, physically also and emotionally also, and then to again stand up and come up ki okay, I want to go ahead and try one more becomes so very difficult, and there is a social trauma also around which people, I mean, they have the impact on their lives as well. So I mean, I would rightly agree to your point that yes, we need to have some basic जैसे हम बोलते हैं ना कि we have a regular health checkups or we have some diabetes checkups, so some basic testing checkups for the couples who want to plan, so that I mean, as a whole, not only medically, but they should not go through those emotional trauma as well, because it definitely affects. And then later on, again to gather yourself and go again for it becomes little difficult. Again, depends from person to person. Some people, some ladies fight back and try and plan. Some lose hopes. So I think this would be a good thing to just have some checkups before planning.
Absolutely right. Means actually there is a protocol that can be followed, because there is something called as a specific entity, pre-pregnancy counseling. So that is a very important part before planning pregnancy. So it includes a detailed history, very important. Why? If there is say family history of any miscarriages, family history of infertility, or say in the sister or in the family somewhere, so that there can be a factor which has been genetically transmitted from mother to the child. So those problems, if history can pick up, and that can be, as you mentioned, a red flag, where if there is family history of diabetes, again there is possibility of that, family history of thyroid disorder. So a detailed history forms one part of this pre-pregnancy counseling. Then comes the the examination. So in examination, when we consider weight, the factor that is considered is called BMI. BMI, body mass index. So beyond a particular BMI, there are more chances of having complications. So that is examined. Routine tests, the blood count, CBC, the thyroid levels, especially the TSH levels, then blood sugars. So these which are routinely checked, the liver function, the kidney function. So these have to be checked as a part of that pre-pregnancy counseling part. And if anything is there, they should be corrected before going ahead with pregnancy. So at least we will not only prevent miscarriage or difficulty in conceiving, but a healthy baby is ensured with that. Of course, the detailed investigations are practically not possible in that pre-pregnancy counseling, but what you have suggested is absolutely important part, and that is pre-pregnancy counseling to prevent pregnancy-related complications.
Absolutely true, doctor. Doctor, in your opinion, I mean, generally, you see so many patients on regular basis. So, what is the rate of infertility these days? I mean, has it increased? Do you feel currently, due to the lifestyle changes or due to the busy schedule that people have, people are planning their pregnancies late due to career and everything. So, has the infertility rate increased nowadays? Is it, or it's there? Same.
No. I think very important question. Everyone must know this, that infertility is on the rise. Okay. Now, if you see the percentage wise, it is generally seen that almost 15 to 17% of women have faced the problem of, or the couples I would say, face the problem of infertility, which is quite big. Okay. And if you see miscarriages, then the chance of miscarriage in any pregnancy is say around 12%, 10 to 12%. But as the number of miscarriages increase, someone has two miscarriages, the chance of miscarriage in third pregnancy increases to 25%. They have three, then next pregnancy 30%. If they have five or more, the chance of miscarriage in subsequent pregnancy is up to 80%. So therefore, the incidence of infertility or miscarriages is really high. And especially if you say infertility, and your question was whether it is on the rise, yes, because there are many factors which are involved. So which are again maybe related to some of them to lifestyle, the food that is ingested, the fast food. These are not good for the health of the woman. Then the stress. Yes, stress directly doesn't cause infertility, but then it has impact on women's reproductive system. It has impact on ovulation. There's increased incidence of PCOD, PCOS, polycystic ovarian disease. You know that it is on the rise, and the contributory factors for PCOS are again this: the lifestyle, the stress, and to some extent genetic predisposition. So therefore, the incidence is definitely on the rise, and more women are then coming with the problem of infertility. And one very important, I think, which in current world that is leading to infertility is planning pregnancy late. Because maybe there's no problem in it, because many of them women are busy with their careers, so they may get married late and then stabilize in their career, and then they start thinking of pregnancy by the time they are beyond 35. Some are close to 40, or if they get married only late, so that and then start suddenly they realize, oh, they are late now. So that is also an important factor, especially in urban area, that has led to increase in infertility incidence. So I think these are a few factors which are
I
important.
can totally relate to what you're saying, doctor. I mean, I would say when I was young, PCOD cases I had never heard about, or maybe once somewhere. But now, if you ask any girl, if you ask five girls, two would be having some PCOD issue or menstrual issue, something or the other. I mean, it is so very common nowadays that every second, third girl that we come across has this PCOD issues, and which that time they don't understand, but later on they might have severe implications of that.
Absolutely, Dr. Apurva. I will tell you one example. Manje, you will feel surprised. A 14-year-old girl weighing 120 kilos, absolute case of PCOD, all symptoms and signs related to PCOD were seen in that girl. What was her lifestyle, food habits? Her day used to start with vada pav. So it has to start with a few vada pavs. And then you can imagine no activity. She says she is busy studying, so no physical activity, no exercise. And the worst part was she was diagnosed with even high blood pressure at that age because of all these problems. So a 14-year-old girl with so many problems, what will happen when she plans pregnancy later on? There are bound to be problems. There will be difficulty in conceiving. There will be miscarriages. So therefore, this problem is on the rise because of this, and it has to be curtailed in time. And it is possible. It is preventable. So I think it's very important that though the incidence is on rise, it can be brought under control. We have to make up our mind, decide not only the medical fraternity, but the patients themselves.
Absolutely agree to that. Doctor, now after such serious conversation, let's start with a game. What if happens? I mean, I'll ask you questions. You can let me know your opinions
Interesting.
on that. What if infertility isn't just about sperm, eggs, or uterus? What if immune system is rejecting pregnancy like it would reject any other organ transplant?
Your question is something which is very close to my heart. Absolutely right. For baby to be formed, of course, we require one sperm, one egg, and a right reproductive system. That is, the tubes should be fine, uterus should be fine, so that fertilization occurs and pregnancy gets implanted. But that is not the only thing. Utna hi nahi hai. Pregnancy requires many other things. So it's like बीज होता है, so it has to get fertilized, it gets in the right type of soil, but that is not enough. It should get water, it should get the right environment. Same thing is with pregnancy. So sperm, egg, uterus अगर अच्छे है तो प्रेगनेंसी रुकेगी, बट इफ pregnancy is not very well protected, then even after implantation it may not grow, or implantation may not occur, or after implantation the growth will be improper, and that can lead to miscarriage. And this protection is the protection of immune system of the mother. So immune system of mother plays a very important role throughout pregnancy. That way इम्यून सिस्टम तो अपने शरीर के सभी सिस्टम्स के लिए इम्पॉर्टेंट है, इट कंट्रोल्स एवरीथिंग, बट स्पेशली फॉर रिप्रोडक्टिव सिस्टम इट प्लेज अ वेरी इंपॉर्टेंट रोल, और अगर हम उसे निगलेक्ट करें तो बहुत सारे प्रॉब्लम्स हो सकते हैं. एंड देयरफॉर व्हाट इफ डेफिनेटली यस, इम्यून सिस्टम इज an important part and not only egg, sperm and uterus.
Right. So could you explain how immune mismatch or overactive immune system can literally stop pregnancy from progressing ahead?
Very important question. I think to understand how immune system plays an important role in pregnancy, थोड़ा बेसिक्स समझना ज़रूरी है कि how does immune system impacts pregnancy and why we should consider immune system. Because you know, every pregnancy is 50% from mother and 50% from father. Okay. And the part which comes from father is totally different to mother's body. Genetically different, immunologically different. So pregnancy is 50% genetically different. Immunologically it is quite different. Or there is one important rule of immune system in our body. आपको पता है, our immune system does not accept anything that is foreign, different from our body. अगर वो अपने शरीर से अलग है तो उसे स्वीकार नहीं करती है, क्योंकि that may be harmful. बैक्टीरिया है, वायरसेस है, हार्मफुल केमिकल है. सो द रूल अप्लाइज टू एवरीवन. समवन विच इज डिफरेंट will not get accepted. Then what about pregnancy? So pregnancy, in spite of being different, usually grows without any problem. और इतना ही, this is such a common thing कि हम उसके बारे में सोचते भी नहीं है कि प्रेगनेंसी तो कंटिन्यू होनी ही चाहिए. बट pregnancy, in spite of being different, grows. Why? Because pregnancy has a special immunological protection. Nature has created certain mechanisms which protect the pregnancy, and these mechanisms are through certain type of protective antibodies and certain type of protective cells which are formed naturally. Very important, because since the time जब से mammals पैदा हुए, कि those who carry babies inside their body, pregnancy is very well protected, but pregnancy has to face mother's immune system. So that's why nature has created these mechanisms which protect the pregnancy, and that's why pregnancy grows without any problem. But when these protective mechanisms fail or they don't function properly, that leads to problems related to continuation of pregnancy or conceiving, and that can lead to infertility or miscarriages, but we don't see the cause. So it's sort of, we don't know why this is happening, but it plays an important role. So that's why immune system is important, and it plays a major role in normal pregnancy as well as those who fail to continue.
I would like to go a little deep in this, that how do you actually check whether you're immunologically healthy, or how do you know? I mean, again, yes, is it always that we have to go through the process of miscarriage and then check it कि okay क्या गड़बड़ है exactly, or is there any way that we come to know that okay, it's better to check these things, not only the test but everything related to, you rightly mentioned that we need to have a counseling and all, but again the trauma is in my head, and I will share my example also in that. Always, I mean, okay, we feel that we are normal, everything is good, we plan the pregnancy and all, but nobody tells us, not even the doctors at times advise us कि okay, ये सब check करना है, या this is important, and okay, once we plan it, there are two things. One is, naturally that time we never even consult a doctor. At times we pre-plan it and then go. There is a chance of having a consultation that you rightly mentioned, but do we always have to go through that trauma of miscarriage and then check it ki bhai exactly what is wrong with my immune system?
So to answer your question, I think a little bit about immune system I would like to say कि immune system or rather immunological problems, आपने सुना है कि there are certain problems called as autoimmune problems.
Yes.
Okay? What happens in this is there are antibodies formed against our own antigens and they affect our systems against kidney, against, so they affect our body organs and they cause diseases. So this is one type of immunological problem. But there is another type of immunological problem which pertains only to pregnancy. What I mentioned just now, that the protective antibodies are not there or cells are not there. So autoimmune problems, they produce diseases, so they can be easily diagnosed because they produce symptoms. लेकिन जो problems pertaining to pregnancy, जिसे हम alloimmune कहते हैं. So the one which first group was autoimmune, this is alloimmune. They don't have any symptoms. Mother doesn't feel any problems. Even if the problem is there, that doesn't affect her health. Sirf when she conceives, she will miscarry because of lack of protection. So therefore, yes, woman need not go through miscarriages before finding out her causes of the problem that has led to miscarriages. But when it is unexplained, because see, it's very important to know that the incidence of miscarriage is really high. I think I would like to share that with you. One statistical analysis by Government of India has shown that in India itself, there are almost 4 million couples who have repeated miscarriages, 2 and more miscarriages. And the science has shown that only in 50% of these couples we find some cause. Because there are certain known causes of miscarriages, and if we do these tests, 50% of patients will find a factor. In 50%, we don't know what is the cause. And in those 50% cases, the majority of them have this immunological problem or alloimmune problem. Okay, so therefore, if there is one miscarriage, yes, even single miscarriage is traumatic to the woman. But there are certain guidelines which say that एक के बाद, usually after first miscarriage, which may be a chance occurrence or it may be a genetically abnormal embryo and which doesn't repeat. So पहले miscarriages के बाद ज़्यादा टेस्ट नहीं होते हैं, which personally I feel everything should be checked after first. But after 2 or more miscarriages, all those factors जिनसे miscarriages होते हैं वो check किए जाते हैं. So why some women face 5, 6, 10? We have 2 patients who had 15 miscarriages.
Oh my God.
So why they face so many? Because they are labeled as unexplained. क्योंकि उनमें 50% cases जो factors responsible है वो all those are normal. And the other they are labeled as unexplained, but उनमें immunological factor है which was not tested. Okay, so therefore immunological part is very important compared to the other known factors. So therefore we can't check everything beforehand. I wish that no woman should miscarry. I always tell in my lectures that we should have a miscarriage clinic where the incidence of miscarriage should be 0. Everyone should be investigated beforehand. But these investigations are also very specific. They are expensive. So it's not that before a couple plans pregnancy, we should do all these tests, and because it may be difficult. If you ask me, I would like to do for my wife. I will check everything and I don't want her to miscarry even once. But this is what is followed. So therefore, not necessary to undergo many, but at least with 1 or 2 miscarriages, it should not go beyond that. We have to investigate and find out.
I mean, I agree to that. We can't be, always foolproof, but at least follow the basic rules and then move ahead and then check whether it is required or not. Correct. Doctor, you've been pioneered in the treatments like lymphocyte immunization therapy. So can you explain how it works and what is the success rate of this?
Very important. I think a lot of our doctor friends ask us, patients ask us, what do you do for these patients with miscarriages? Because I just mentioned that there are so many patients who have miscarriages which are unexplained, or if for that matter IVF failures which are unexplained. And in these cases, there can be an immunological factor which I just explained, because the pregnancy requires protection, protective antibodies, protective cells. So if they are not there, then they will keep on miscarrying. So in such cases, first thing is we have to find out whether they really have this problem, and only then you can treat. So I would like to tell a little bit about the investigations part also, because we must know whether they have those protective antibodies in there. So we do certain tests. The most important test that we do is called as a lymphocyte cross match, husband and wife's blood together, to know about the protective antibodies. And if they are already there, then the problem may not be immunological at all. She already has those protective antibodies. But if they are not there, then we can give a treatment that will help induce these protective antibodies, and that is the treatment of lymphocyte immunization therapy, or LIT. And we have a patented process of this where we have made certain modifications in it, and have a patented and a branded process called Immulate, which helps in these patients. Along with this cross-match, there are other tests which we do, like natural killer cell test, or a chemical called as TNF-alpha, which is a destructive type of chemical which becomes high in these patients, which indicates immunological problem, or anti-thyroid antibodies. So if they have this problem, then we use this treatment of Immulate, which you just asked me what it is. So it's an immunological treatment, and so which we use for these patients.
So doctor, is it kind of a mandate that okay, अगर IVF fail हुआ तभी ये procedure के लिए जाना है, या if there are more than 2 miscarriages, then only opt for such treatments or something? I mean, I am constantly looking at the issues the couple, the lady faces. So that is actually troubling कि okay, ये सब try करने के बाद ही हमको ये करना है कि we can do it.
Absolutely valid question. I will tell you one story. One couple had come to us from Assam. They had 5 IVF failures, 5 times. All her investigations were normal, and she was moving from pillar to post. She came to Ahmedabad to do her IVF. So someone suggested that please go to Dr. Raut and check whether there is an immunological problem. She had that problem. So we treated her, and after that she was to do her IVF. So after 2 months she called up, said, "Doctor, I'm pregnant." So I said, "When did you do IVF?" She said, "I didn't do IVF. I conceived naturally." So she only had that immunological problem. So therefore, it is important that to know whether the couple has that problem or not, and only then go ahead with the treatment. I think what you asked, what you meant was whether this will be required for everyone, or we have to wait for that many. So because the only question she asked us afterwards is why I was not told about this before.
Absolutely.
So that's why I said your question is absolutely relevant. And it's not that everyone goes through that. We have now our doctor friends who send these patients to us even before IVF. They have failed conceiving by treatment. They have failed with IUIs. Before IVF, they send to us. They say, oh, if this problem is there, then treat first and then we will see. We jokingly tell also these doctors that you are losing your IVF cycles in this, isn't it? So they say, no, you are wrong, doctor, because one thing is we are doing the right thing, what is required for the patient. And second thing, they said that because of that, I have a reputation that I do IVF only when it is required. So this one patient who did not require IVF brings me 10 patients who they require IVF. So what I mean to say is we don't have to wait that long, but at what stage this immunological thing should be considered is we leave it to the doctor. Because one more thing I would like to tell here is that we don't do IVF. We don't do fertility treatment also. We do only this immunological treatment. So we help patients, our doctors, say IVF doctors, improve the success of their IVF. We help gynecologists to help their patients prevent miscarriages. So they take the treatment, they go back, we suggest certain medications after our Immulate treatment, and it helps them in continuation of pregnancy or preventing IVF. So yes, the question is absolutely valid. At what stage it should be thought, we leave it to, I think, to the conscience of the doctor, or for that matter to the patient. If patients are more aware, they are now insisting that, tell doctor that please can we rule out this factor and then go ahead. And it has helped a significant number of patients who have this problem. Otherwise, of course, they have to go through so many cycles or so many miscarriages.
So, doctor, just I wanted to elaborate on this. That I agree that every body is different. The complications every body face is different. So, the statement that you mentioned, that it depends upon the doctor and the patient what is required, which treatment is required, and accordingly take a call and go ahead with that. But as per your experience, so many patients that you handle, do you feel that at what percentage these immunotherapy would help and has helped so many of the ladies and the couples to overcome this?
Yeah, very important question, because we have experience over last 30 years in our 7 plus centers where we are giving this treatment. But a little more about the statistics I would like to tell, which I think I mentioned before, but I will just tell again that those who have miscarriages, 50% of them don't know what is the cause, and majority of these patients will have immunological factors. So that number is significant. If you come to IVF, patients who undergo IVF, almost 10% of them undergo repeated IVF failures. They are called as recurrent implantation failures, or RIF. So almost 10% of patients who are undergoing IVF undergo this, and we don't know the cause. Again, a significant number of these patients require immunological treatment. So therefore, the number is really big. Now, if we select these couples for treatment, which is very important, if they are likely to have immunological factor, that is not the only thing. They are likely to have, but whether they really have, so therefore we do the testings. And if the test indicate that this problem is there, and if we treat them, almost 75%, 75 to 80% of them do well. And whether it is related to IVF, whether related to miscarriages, because it is very important to select and give it to the right type of patient, and medically it is called as the right subgroup of patient who will be benefited with this. And these rates are comparable with the international rates where it is done at centers abroad.
I mean, quite helpful actually.
Definitely.
Doctor, and for couples listening right now who have faced repeated issues like this, what does reproductive immunology offer them that traditional approaches don't? I mean, we've already discussed, but anything specific that you want to highlight that, okay, this therapy is, something better to offer than the traditional therapies that we've been following since long?
Your question is important, but here I would like to say that these two are maybe different things. There are certain factors which lead to IVF failure to conceive, leading to infertility. Certain factors will lead to IVF failures, or certain factors will lead to miscarriages. Now, a patient who has both the tubes blocked, she will require only IVF. She will not conceive without IVF. But that IVF also may fail if she has immunological problem. Okay, so therefore we have to keep both these things in mind, and because these factors may coexist. Someone may have severe PCOD, she is not ovulating, and therefore she is not conceiving. You do IVF, still she is not conceiving, but she can have additional immunological problem. She may have certain problems related to uterus, the lining is not properly growing, and therefore she is not conceiving, but she may also have additionally immunological problem. There are patients who are miscarrying because there are certain conditions known as thrombophilias, problems related to blood clotting. So they are there, they can lead to miscarriages. So these patients are treated for thrombophilia, still they keep on miscarrying. Then doctors say, oh, we have treated that factor, but have you checked the other factor, immunology? So that may be coexisting. So therefore, it's not one over the other. It is everything together we have to investigate. And therefore, it is very important that even at the beginning of the workup or investigations, if we rule out immunological problem, then that will help many patients overcome their problem and in the first go itself, rather than as you asked. I think that's why you asked whether they will undergo 2 or 3 miscarriages, then you find out it is immunological and then treat, which happens still happens, and then patients ask why we were not told before. So if these become part of your workup, then that will help solve the problem early. Because I think, we do only reproductive immunology related work. Me and my wife, both of us are gynecologists for almost 35 years. But we now practice only clinical reproductive immunology. We don't do gynecological work, obstetric pregnancy related work, even fertility work other than the immunological work. We don't do IVF, but we help, as I mentioned, IVF centers help improve their success rate or prevent miscarriages.
I mean, doctor, this is quite an helpful information because many a times it happens that, as I could give my example as well. When I had planned my pregnancy, I had a first miscarriage. Everything was normal. The reports were normal. We had done a karyotype also. That was also normal of the fetus. Almost in after 2.5-3 months, between the 2.5-3 months, I had a miscarriage. Yes, after that I had a natural pregnancy also after 6-7 months. But that time the cause was unknown. We were not told, or we were not informed that what could be the probable reasons or what could we test to find out. And also, and I understand the trauma that I had gone through. So that's the reason it is sticking in my head, that why every female who has to go through this issue if there is a miscarriage. And secondly, I would say this information should be widespread with the doctors as well, so that they inform the patients and help them come out of it. And you rightly said that these all things go hand in hand. ऐसा नहीं है कि यही treatment करना है, वो मत करो. And we are not into that concept कि this is bad and this is good, or this is good and this is bad. But it goes hand in hand so that in the end the patient is benefited. So I totally agree.
Yeah, absolutely right. See, this is a very personal issue. The patient miscarrying or failing IVF means they are so much involved in it emotionally. I will tell you one story where patient had repeated IVF failures. So now after that, she had the next IVF cycle. She had 6 embryos which were frozen. So they had named those embryos names, and they said this month so and so Rohan and Mohan will be transferred. Next month, they don't know which male or female. They didn't know, but they are given names, and so that's how that much of involvement patient has. So if that doesn't succeed, you can imagine the level of trauma. So therefore, this problem is really big, and we feel that that's why we are working only this field, because even if we feel if we help one couple who has this problem, then definitely we feel our becoming a doctor
Truly,
has
doctor,
really
truly.
is justified. Because someone who has 15 miscarriages, I told you we had 2 patients. So one was from Ireland. She had 8 miscarriages naturally conceived. Then underwent 10 IVF cycles, of which 7 times she conceived and miscarried. So she came here, she took the treatment, and now she has a son. The other couple had as a daughter now. So both of them have children. And with IVF failures, there are so many. So the blessings that we get from them, or even a message, we have so many WhatsApp messages with us. So that really keeps us going. So therefore, yes, this is very important, and whatever possible should be done. And therefore, as you mentioned, not only patients, doctors also must be aware about it. And they are. But then, see, it has to be on a larger scale, and so that patients are helped in time, and you prevent all these emotional problems and the IVF failures and miscarriages. And what you are doing here is a part of that, and therefore I must thank you also for doing that, because this is going to create awareness.
Yes.
And not only with patients but with doctors.
True, absolutely. I mean, that is the major reason we are calling experts, because we should hear right from their mouth and understand that okay, these are the facts, and we can create some basic awareness, so that helping people in turn, I mean, I would say the blessings that you mentioned. So I know that in the end, that is what I'm going to gain.
Absolutely right. When one such patient I'll give one more example. So she had IVF failures, never conceived. abroad. Then she came to India, did ovum pickup. All embryos were genetically abnormal. So she did surrogacy. She failed twice surrogacy also. And then she came to us, someone told us, find out whether there is immunological problem. We treated her with for the immunological problem, and you will not believe, underestimate nature, what nature is doing. We are just getting more information what nature is doing the right way and extending it to other patients so that it
Just
will be
this
helpful to
support
them.
would, I would say,
So this
help.
is happening otherwise naturally. So many patients don't require anything. They don't know also how they conceive and how they deliver because nature is taking care of it. But when it doesn't, that's where they maybe all of us come in picture.
True.
And it is our moral duty to help these patients overcome their problems.
Absolutely true, doctor. Doctor, let's move on to our next segment, myths and facts. So many patients come up with lots of queries, and we don't know whether they don't know whether it is true or whether it is just a trend that they are following and all. So let's have some rapid fire myths and facts.
Definitely.
So again, I have asked this again. If IVF fails, will it keep failing? What do you? I mean, any words on that? It's a blanket statement.
Very important. I think you have got the right question because patients ask us when they come with IVF failure, because some of them have undergone 2-3 failures, so they feel once it is failed, it is going to fail again and again. But scientifically, if you see, it depends on why it is not continuing or why it is failing. So if the reason is abnormal embryo, the embryo is not good, then if that is corrected, it will not fail next time. So it depends on the cause many times. But many times when it is not known why it is failing, that is, embryo is of good quality, genetically tested, uterus is fine, or the lining is fine, because these are the 3 things which are required for IVF success. In spite of that, it is failing. Then patient feels it will keep on failing, and in that case, there can be immunological factor, what we just discussed, and therefore, it is not necessary that if IVF fails, it will keep on failing. But if we don't find out about immunological factor, it will keep on failing. So partly maybe it is
Yes,
true,
so it's
but
not a
it's
blanket statement that it will fail again
But it's a
and again.
myth that it has to fail every time, because we are not going to allow it to fail every time. So in spite of that, when it fails, we are missing out on something. So that is the gist of that.
Miscarriages are mostly due to stress or working too hard.
All patients ask this. डॉक्टर, मैंने उस दिन बहुत काम किया था, इसके लिए हो गया, I lifted weight, is that the reason? So see, one thing is that stress is part of our life. We can't remove stress. Okay, so and the fact is, stress is not the one which is directly responsible for miscarriage. I can say that stress बहुत ज़्यादा है, इसके miscarriage हो गया. Otherwise, half Mumbai women will undergo miscarriages because of stress, or for that matter, everyone goes. So therefore, stress is not a direct factor, but yes, stress affects our body systems because it affects the hormonal pattern, it affects ovulation. So therefore, it can complicate if problem is there, that can be complicated by stress. Second important thing is having miscarriage itself is a stressful factor that adds to the stress. Okay, so therefore sometimes it may not be the cause, but it is effect also of that. So it becomes a vicious cycle. You miscarry, you are stressed, you stress, then it keeps on increasing, but it's not an isolated factor. At the same time, it is scientifically proven that tender loving care, as it is called as TLC, is an integral part, an important part of treatment of patients who have miscarriages. And studies have proven, उन्होंने दिखा दिया है कि if tender loving care is given to these patients along with medications, the chances of successful continuation of pregnancy increase. So that in a way you are taking care of stress. So stress is not directly causing miscarriage, but managing stress is going to be, or it is always helpful.
Dr. rightly said, I would say there is nobody here who will say that I'm stress free. It's only that how do we manage stress is important.
Exactly. How you deal with the stress, how you react. The right word is how you react to the stress. Someone will react with becoming absolutely aggressive and angry. The other one will just leave it as it is. The important thing, as it is said, see whether this stress is because of factors which are under your control or not.
No.
If it is not under your control, leave it.
Absolutely. Unexplained infertility means you will never know the cause.
Very important, because this also patients ask, if doctor, I have unexplained infertility, then how will I conceive? So here the word unexplained means till now we don't know what is the cause in your case, but we will find out. So therefore it is unexplained till today, and usually these are the patients where the routine regular causes of infertility have been tested
Ruled.
and they are normal.
out.
For example, sperm count is good, ovulation is there, uterus is fine, tubes are open, still they are not conceiving. But there are subtle factors or silent factors like the immunological factor, what we discussed, alloimmune factor. So those, if they are not tested, these patients are so-called, I always say they are so-called unexplained, but into inverted commas. But if we investigate them further, so they will definitely be explained. An important thing here is we always use the term infertility, not sterility. Okay, sterility is an endpoint where there is no hope now. So it's never used. Even if the woman is not able to going to conceive, it's always infertility. That word itself indicates hope. That yes, she is going to conceive. Till now, she is not fertile, but she will become fertile later on. So therefore, unexplained also is sort of a misnomer, and infertility is a very important word and not sterility.
Doctor, you've given us a new hope in this word infertility. I mean, as you rightly explained right now, that infertility doesn't mean that you will never conceive. Infertility word itself says hope, which is a very, very, I would say, a big statement, and which all our viewers and patients should understand that okay, there is always an hope. Rule out one possibility and move ahead.
Absolutely.
Doctor, immune therapies in infertility are still experimental and unsafe, or what do?
No. Now, let me tell you, the immunological aspect of fertility has been tested or has been investigated or researched not now, but more than 30 years or even 30-40 years back, this fact was known. So over these years, research has been done. So it's not a new thing, it's a known thing. Everyone knows immune system affects pregnancy. The treatments that are given, especially the one which we give, the lymphocyte immunization therapy, is a proven treatment. There have been studies which have done, there are meta-analysis in medical terms. These studies are analyzed together to know the success rate or chances of success. And related to lymphocyte immunization therapy, the recent meta-analysis has shown that the chances of success are more than 3 times in those couples who have taken this treatment compared to those who have not taken treatment. So they are proven treatments, they are not experimental. The only thing, sometimes this word is used because there are ways of statistical ways of analyzing in medicine. Analysis is done. So in certain therapies which are personalized therapies, I'm going a little bit into the medical aspect of it. Personalized therapies like lymphocyte immunization therapy, it is very difficult to have double-blind studies. So these patients or these studies are analyzed by a statistical method called as n is equal to 1. So where the patient is the control and patient is the subject. So patient has taken certain medications before the problem, then they were treated with immune treatment or LIT. Again, they go back and take the same medicines. The only difference is this treatment, and then see the success rate before and after. So that's how the analysis is done. So therefore, and this method is called as experimental method of statistical analysis. So the treatment is not experimental. The analysis method is experimental method or quasi-experimental method. There are 2 ways it is done. So therefore, definitely it is not experimental. It has been practiced world over. different countries, this particular treatment is being practiced. The medications that are used after this treatment, we recommend certain medications which are used globally everywhere, but still the treatment of emulate or the lymphocyte immunization therapy is the main part, because it creates an environment like natural protection of pregnancy, and therefore it creates a condition which protects the pregnancy actively, and this is complemented by medicine. So it's a proven thing and not just experimental.
What's fact, what's friction, and what's the science we should actually trust? I mean, if you can give your end quote on that.
So you mean regarding this treatment, or
Yes, regarding this treatment.
So see, finally, science has a basis. The science is based on three things actually. Means our medical practice is usually, we say it has to be evidence based. Only then you can trust it. So this evidence means what? It has three parts. One is the research that is done. So therefore, to know, to believe on any particular thing, there is a research which is done. And it shows, if you this research has shown that this particular treatment is beneficial. But that is not the only thing. The second part is doctor's clinical experience. Okay, so I have treated so many thousands of patients who have, say, for example, miscarriages, and we have used this treatment, and so many percentage of them have been benefited. So my clinical experience is important, because our human bodies are not machines. So each behaves differently. So one single treatment is not applicable for all. So therefore, our clinical experience is important. So the fact of research has to be again checked with facts of clinical experience. And the third part is the patient preference. Means the patient has to be taken into confidence, explained everything, and with his consent, you give this treatment. So therefore, your statement about facts, about science is very important, because science is concrete and it requires proof. But that proof is from these three factors and not just a research thing. Has to be a clinical experience and the patient's participation. So I hope that I have explained what you mean. Or if there is anything else related to your question, you can just tell me.
In fact, I would totally relate to that. Unless and until patient accepts and is ready to follow certain things, whatever the doctor does, it might not work. And as you rightly said, that the clinician who actually is treating the patient, their experience, their expertise, the patient's willingness, and the treatment that you've mentioned, all three hand in hand will definitely, as you rightly said, I'm going to remember the statement: infertility is hope and not the end of it. So that is now struck in my head would be struck in my head for a very long time now. And yes, hope is what we believe in. And thank you so much, doctor. I mean, I think we tried our best to explain the basics of it, so that people know about this treatment, get awareness about it, and there is always a hope. Try and find out things with your expertise, with your experience. You've given so many examples, so I am very sure that our patients, our viewers, whoever is watching us, will definitely find some importance, and will be helped by some way or the other. And I'm so very grateful to spare some time for us and coming here for our patients. Thank you so much. And anybody wanting any more help, we are always there to help. Just comment hope and we will be right there to help you for any further questions. Thank you so much, doctor.
Thank you, doctor.
Doctor, what would be your last take or a last message for our patients, for our viewers? Anything that you can, just in a nutshell, if you can tell us how to go about.
Yeah, I'm not a guru or something like that, but with my experience in this field, I would like to tell everyone that infertility or miscarriages, or for that matter IVF failures, they are not the end of the world. See, it's not that they don't have solutions. They do have. You have to go to the right doctor, trust the doctor, trust whatever treatment he or she gives you, and I'm sure you will definitely fulfill your dream of having your own baby?
Thank you so much, Doctor. I mean, I would say these are the two pillars: awareness and trust, and get informed about everything. Just close yourself and sit down and be bogged down by the issues that you have. Talking and listening and speaking out your issues are very, very important. And thanks a lot for being here today. Your experience, your expertise have helped us solve so many queries, and also knowledgeable that something like this exists, wherein after, even if so many miscarriages, there is a hope. As I mentioned earlier also, infertility is not end of the world. It is the hope that we carry forward. So this is rightly struck in my head, and I go with this message. And for all the viewers, for any more information, any help, anybody in your family, friend circle who has gone through this process and is suffering, please do get back to us. We will try and help you. Just comment hope in the comment box, and our team will get in touch with you. And thank you so much, Doctor, for being here today. It was pleasure talking to you.
Thank you so much, Dr. Apurva, for the opportunity to be here on this podcast.
Thank you.